welcome to Medical Dialogues. I'm Mr. Zaman and here's what I bring to you all from the world of medicine. Classic triad of meningitis symptoms rare in both children and adults found in recent study. Prompt recognition of symptoms and treatment is vital for good outcomes in cases of meningitis. However, new research to be presented at this year's European Congress for Clinical Microbiology and Infectious Diseases, that is ECCMID 2023 Copenhagen 15th to 18th April, shows both adults and children mostly have only one of the classical triad of commonly related symptoms, which is fever, altered mental state and neck stiffness, and rarely have all three, with a substantial proportion, that is 1 in 7, having none. The study by Danish researchers was a retrospective observational study of pre-hospital and hospital data in patients with community-acquired bacterial meningitis or CABM between January 2016 and December 2021, admitted to a hospital in the capital region of Denmark. Reported symptoms were extracted from archived audio files of the initial phone call to the emergency medical services. The most frequent symptoms were altered mental state and fever, while neck stiffness was less common. Study highlights possible treatment strategy for bone marrow failure syndrome. Research led by Washington University School of Medicine in St. Louis had identified a possible treatment strategy for a rare bone marrow failure syndrome that is named poikiloderma with neutropenia. The work also may have implications for treating other bone marrow failure syndromes with similar underlying dysfunctions. Poikiloderma with neutropenia is caused by mutations in a gene called USB1. Despite knowing the genetic error that causes the disease, the specifics of what the error does to cause bone marrow failure have long been a mystery. When the bone marrow fails, the body can't make healthy red blood cells, white blood cells, and platelets. People with these type of diseases are at an increased risk of infections and are prone to developing skin and blood cancers. Study finds for older adults every 500 additional steps taken daily associated with lower heart risk. A new study found that walking an additional 500 steps, or about 1/4 of a mile per day, was associated with a 14% lower risk of heart disease, stroke, or heart failure, according to preliminary research to be presented at the American Heart Association's Epidemiology, Prevention, Lifestyle, and Cardiometabolic Health Scientific Sessions 2023. Researchers analyzed health data for 452 participants who used an accelerometer device similar to a pedometer worn at the hip that measured their daily steps. Participants were an average age of 78 years old. The devices were worn for 3 or more days and 10 or more hours, and the average step count was about 3,500 steps per day. Over the 3.5-year follow-up period, 7.5% of the participants experienced a cardiovascular disease event such as coronary heart disease, stroke, or heart failure. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.